If you're a driven, active person who wants to reach and pursue a higher quality life with some ambition, then guess what? This podcast is for you. This is the Driven Athlete Podcast. What's up, y'all? It's your man, Dr. Kyle, back here with another cool episode. Motion is lotion. This is something that we say all the time. And I picked up this quote from my fellowship training in Houston and my sports and orthopedic postdoc fellowship training. It was like a 3-year program on manual therapy, clinical reasoning, and clinical decision-making, differentiating. All right. So, and differential diagnosis. So motion is lotion. I say this all the time. All right. And the reason why we say this and rest is rust. All right. I hear that all the time from people like, I just need to rest. I need to rest like 6 weeks. I'm gonna take some Advil, ice, and just rest and don't do anything. And then I'll come back. Well, I'm like, that's not going to help solve the underlying reason why whatever the issue is came in the first place. If it's non-traumatic pain that comes to active people that just seems to like develop for no reason, that's our wheelhouse. And there's a reason why that stuff develops. So resting isn't going to solve that reason why it came in the first place. But motion is lotion, right? We say that because it's going to help develop synovial fluid and blood flow and help get things to settle down, which I'll explain in depth right now. But anyway, the overall treatment approach, we have to solve the underlying problem, the underlying reason, the cause of why the pain started in the first place. And just resting isn't going to do that. And then imagine if you're not solving the compensation patterns that led to the problem in the first place, just jumping back into sports or whatever your thing is, you're going to go back with the same mechanics and same compensation patterns. So something's going to come back. Does that make sense? So we ask our clinicians that we mentor and help educate with this process. If we ask them, your patient's getting better, cool. If they went back to their sport or their activity 100% full go, unrestricted, is the pain coming back? Because if it is, then we didn't solve the underlying problem, right? And that's where our clinical decision-making and our treatment approach comes in, okay? So anyway, motion is lotion. Why? There's a membrane in every single joint called your synovium. All right. Your joint capsule is a thin sheath of soft tissue that helps to stabilize all the joints in your body, like your shoulder, your wrist, every single joint. All these joints have a joint capsule if it's a true synovial joint. Okay. And you have two bones that articulate and rub against each other, right? And the joint capsule is just a thin sheath that helps to create another layer of stability for that joint. On the undersurface of that membrane of your joint capsule is a membrane called your synovium. And your synovium's key role is to lubricate the joint, okay? And the synovium produces synovial fluid, which is a lubrication fluid, when the synovium itself senses movement and friction. So when the synovium in your joint capsule feels friction and movement, it produces and is triggered to produce synovial fluid. And that synovial fluid is the life blood and source of nutrients for the articular surfaces of your joints. And when I say articular surfaces, what I'm talking about is your cartilage. All right. The cartilage and the bone structure and the joint capsule for the joint fluidity and movement of that joint with the least amount of friction and resistance as possible. Right. The synovial fluid is what allows that to happen and be very, very, very slippery. Right. And less friction as possible. I heard a mentor of mine describe that the friction resistance, the resistance coefficient between two articulating joints with synovial fluid is less than rubbing 2 ice cubes together. So that's how slippery it is. Awesome. We can help trigger more of that to be developed, and we can stimulate on purpose for the advantageous benefits of all your joints, whatever's lit up and irritated. We can stimulate more development and production of synovial fluid by moving those joints on purpose, right? Through a full range of motion. The key is non-painful movements, right? So that's where our corrective exercises and creativity on purpose comes in, our purposefulness of choices. Something else I always describe in our fellowship program for the clinicians that we mentor is purposeful discretion for our manual therapy choices and our corrective exercise choices, and the intensity and the volume, whatever, of these corrective exercises that we're prescribing to our patients to fix their underlying compensation patterns. Why are we choosing it, and why wouldn't we do something else, right? Manual therapy and corrective exercises, and then what intensity and what level and what are we cueing them to do, right? So we can stimulate and purposely get more synovial fluid to be produced with movement, and the key is non-painful movement. okay? Non-painful movement and non-aggressive, non-irritating movement. And I have a great idea. What if we work on the compensation pattern, the compensation movements to fix those in a non-aggressive, non-painful way? So we're fixing the problem and we're stimulating more synovial fluid for the pain relief and also stimulate the joint health. And imagine doing that in a non-painful way and fixing the mechanical compensation patterns, muscle recruitment, joint mobility restrictions, and joint mobility disparities, and those compensation patterns. Imagine working on those two things for 8 weeks, where every single time you leave a session with us or your own workout, when you're done working out, you should be saying, you know what? I feel looser. I feel better than when I came in. Perfect. And we worked on the problem. Great. That's a win-win, all right? And then, hey, when you go home, work on X, Y, and Z, and this is what it should feel like. And this is what the expectation, right? This is what you want to avoid, and this is what you should feel and what you should expect to look for when you're done. So when you're done, every single time, I feel better. Yeah, I haven't felt like this in like 8 months, 6 months. Like it feels good. Do you have any pain right now? No, perfect. That's the goal. And imagine that sensation or that course trajectory over 8 weeks. What does that look like 8 weeks from now? Right? Game changing, right? You're going to be gradually making things more challenging and progressively more involved and loaded over many, many episodes and many weeks, to the point after 8 weeks, you might be full go at that point, right? We'd have to teach you what to do and fix the compensation patterns and the recruitment of your muscle stability patterns. And that's what helps fix the underlying compensation patterns that we call a movement system impairment that led to the problem in the first place. And we did it in a non-painful way and actually built and fortified the joint and solidified the improvements and the joint health itself. By stimulating more synovial fluid, we improve the joint capsule mobility and all the muscles that connect everything to strengthen the heck out of everything so it can tolerate the load that you're trying to go through with your sports, your activity, whatever you want. Does that make sense? I mean, this is game changing. This is the whole approach. This is the key to life. Motion is lotion. It's going to help stimulate more synovial fluid and improve the joint health of your articulating surfaces in your joints, which is your joint cartilage, your articular cartilage, all right? And the other crazy thing is, and this is very controversial, and I don't know if I'm going to get a lot of flack for this, but it's in the research. That approach with appropriate load, because we need to compress things. We need to compress your joints. It's on purpose. Not too much where it's too stressful and irritating and painful, but enough to stimulate synovial fluid and enough to stimulate a healing response and a neural response, and that's going to help build and solidify the joints. Imagine doing that over a 2-year process, not stopping, like appropriately, intervening appropriately, working on your joint mobility, working on your muscle recruitment patterns, right? 2 years is a long time. And imagine doing that with the right mental approach, the right perspective for a 2-year process, or even a year, 12-month process. Some of the studies that I'm going to reference right now have been 12 months. Pre and post X-ray and MRI of the joint, the bone for the X-rays, and then the soft tissue and articular cartilage integrity over many, many months, like 12 months, actually finds the articular cartilage is thicker and more vibrant and brilliant on imaging versus people that didn't do it at all. And their actually articular cartilage is thinner and more brittle than their counterparts. So it's like, this is it. This might be the answer to arthritis, right? Like to help improve arthritis, but maybe even prevent it from happening in the first place. Of course, we'd want to do that. And if somebody's battling severe joint pain, instead of getting a joint replacement, if they're able to tolerate the long process and the guided mentorship and shepherding during that process, if they're able to have delayed gratification, believe in something over many, many, many months, then they could avoid a major surgery and cost of that. Like, what's the cost of the surgery versus the cost of trying the conservative route? It just takes a long time. You got patience, right? Like, it takes delayed gratification over many, many months. But imagine going through that process. According to the research, joint surfaces and articular cartilage is actually improved with that approach. A purposeful compressive forces, intermittent compressive loading over many, many months, and their articular cartilage is actually improved. That's insane. That's mind-blowing, right? That might be the key to fixing arthritis. Like, it's crazy. You just have to have the right person with the right mental approach and perspective going into it, knowing that it's not a quick fix. This is a year process, 8 months, right? But what about 6 months? Imagine, would you feel better? Would it be unreasonable to think that you would feel better in 6 months if you did non-painful, non-aggravating, or non-irritating movements over a 6-month period, working on the compensation patterns, joint mobility, muscle strength and stability, and everything doesn't hurt worse every single time that you're done? things will get better and better and better over many, many weeks and months. I would be very, very confident to think that for anybody, after a 6 month per time, they would feel significantly better. And the reason why I say I'm confident is because I've done it before with people. All right, we've done this. We're living it. We're not like just making stuff up. Like, we've done this before. Okay. The education component is huge, definitely. And the right perspective and approach going through it is huge. And every day you'll have good days and bad days. But the overall trend is to be a positive trend over many, many months, and avoiding the major roller coaster of like, I did too much and now it's hurting, right? And I effed it up. It's like, there we can avoid that. We can control that factor, right? Sleeping posture, we can control that. Sitting posture, work posture, we can control that. Your perspective and approach and beliefs, we can improve. We can control that. We can control the load. We can control the intensity and the exercise intensity, the volume. We can control all that stuff. Things don't hurt for no reason. That was a podcast I did earlier, and this is the same kind of boat with that stuff. But anyway, motion is lotion, and that's why we say that. The more motion you get, the more lotion you're producing on purpose for your joints through synovial fluid from that synovium that feels and senses compression and friction, and it stimulates synovial fluid on purpose. So like, we can leverage that purposefully in a non-painful, non-aggravating way, and that's the best way to improve joint pain. And in the meantime, hey, mind bomb, what if we work on your compensation patterns also in the meantime, and your joint mobility restrictions and your muscle recruitment strength disparities? And those two things combined over many, many months with motion is lotion, more joint fluidity, more synovial fluid, improved capsule mobility, improved neural hypersensitivity that improves and deregulates over many, many episodes of time. That's the way we can really help people over a long time. And this is for people with chronic issues and stuff too. Things don't hurt for no reason. And we would love to help and work with you and shed this mind bomb and epiphany with you guys. But I promise this stuff does work, and things don't hurt for no reason. But motion is lotion, and that's the big key. And that's something we say all the time, and that's why we say it. So we'd love to help you guys. Don't hesitate to reach out. We love answering questions. We love having purposeful discussions and shedding light on this stuff, but helping people in the community, which is why we do it in the first place, of course, and change people's lives in the course of their whole life trajectory. I mean, imagine that. It's crazy, right? It's awesome. But that's what we do. That's why we do what we do, and it's fulfilling for us. So we would love to answer questions. If you have any questions, reach out to us at 561-899-8725. That's our clinic phone number. The best email to reach us is team@athleterc.com, team@athleterc.com. Or you can visit our website at athleterestorationcompany.com or on our Instagram. But always reach out. We'd love to talk with you people, and we'll catch y'all next time. Hey, hold up. As you know, we're a small local practice, and we don't run any ads or sell anything on this podcast, but it would mean the world if you could share, write a post, or word of mouth recommendation for somebody just like you that's athletic and active that wants to live their dynamic lifestyle, and pay some good karma and pay it forward to somebody else just like you. And who knows, you could change their world, and a 10-second review could be that avenue.